Say hi to Bear.
She hasn't even eaten anything. Why is she spitting up?
Well, honey, we can't bug them again. Okay.
I'm sorry, it's our first kid. We're both a little panicky, I guess.
Well, you gotta ask the pediatrician next time. I just deliver him. She spitting up?
Yeah, I'm second time in an hour.
You lived underwater for 9 months. You'd have a lot to spit up, too.
Something wrong?
A little lethargic.
Well, we didn't think...
She's hot.
Is she,
Hey, you Susan, get the crash cart!
What's wrong?
Some help in here!
Oh, God. Is she all right? Access?
No, anything.
What's going on?
We have an infection spreading in the hospital.
These kids have totally unrelated illnesses.
They fell sick within 4 hours of each other. They had the same delivery rooms, maternity rooms are neighboring, so transmission's possible. They have the same symptoms.
The hearted girl has a bowel obstruction. No matter how close their beds are, I'm pretty sure kids can't share blockage.
What does bowel obstruction on a chart indicate?
Well, normally I'd say it indicates a patient's bowel is obstructed, but I'm pretty sure you have some deeper truth to impart.
It means that some random doctor of indeterminate skill thinks that the patient's bowel is obstructed.
Okay, you're upset because they threw you out of their lounge.
Look at the x-ray. It's a normal gas pattern.
You want? I can get you a key to the oncology lounge.
Air in the colon.
We're getting TiVo.
If it's air, no bowel obstruction.
Even if it is air, it could have been there before the obstruction.
No. Something's infected both these infants.
We've definitely checked the whole floor. Good news, no epidemic.
Tragic, huh?
Overflow rooms, 3rd floor.
This imaginary infection has spread to the next floor?
We were just gonna call.
Did he get hot all of a sudden?
Yeah.
Well, you look cheery. What's going on?
The Hardig and Chenlapino babies. Their kidneys are shutting down.
And the urine tests show no casts.
Which means the antibiotics are causing the kidney failure.
You're the nephrologist. Which one did it? We'll take him off that one. Don't tell me both vancomycin and aspirin.
They both can cause this. There's no way to know which one it is. No test.
We can't take them off the antibiotics. They'll die of the infection.
But if we leave them on both the antibiotics, they'll die of kidney failure.
So we take our best guess then. Which drug's causing the kidney failure?
It's like I said, it's always MRSA in hospitals. Take them off aspirin now.
I still think it's the Pseudomonas. I vote to take them off the vancomycin.
There's no point in guessing. Take one kid off vancomycin, the other off aspirin.
They have the same disease. You want to give them different treatments?
What the hell are you doing?
Therapeutic trial to find the cause of the infection.
That's wrong.
We have 4 sick kids at least. Who knows how many more haven't started showing symptoms yet.
We have a duty to these 2.
If these 2 have different reactions, we'll know how to save the rest.
So you're condemning one of these kids to die based on random chance?
I guess I am.
Dr. Chase, active P on the monitor.
How long?
I don't know, it just started.
Pulse? Fluid wide open. Do we have an arterial line?
Not yet.
Let's get a BP.
You can't come in here.
Is my baby dying?
Mrs. Hartley.
Is she dying? Ma'am, you'll have to leave.
It's not your baby.
Fenway. BP 60/20.
Heart rate's 180.
You start to leave the fat.
Got it. Still dropping. 50/10.
Can't hold BP even with 3 pressors. We're losing pulse.
VFib.
Shut the blinds.
Charging.
Sir.
Clear.
Still VFib.
Charging. Clear. Charging. Clear.
still VFib.
Charging. Clear. Charging.
Chase. Time of death, 6:57 p.m. It is a virus infecting their hearts.
Man, we're screwed. We can't chase down a virus. There's 1,000 possibilities.
So we could run gels, antibody tests.
1,000 of them? The kids don't have enough blood.
Chase, you're the intensivist. How many could we do before we risk exsanguinating the kids?
You're talking vials, not stick tests? I wouldn't take more than 5 or 6.
Okay, so we have to narrow the 1,000 viruses down to 6. Now, the autopsy's shown us what the virus does. So, let's go. What do we know?
Ribavirin and acyclovir don't knock it out.
Cross out the herpes viruses.
Also, adenovirus. What else? What else? Keep talking.
Well, it only seems to hit children. The mothers aren't sick, so...
No toxoplasmosis, no rubella. Cross out the entire torch syndrome.
You didn't find any lung damage?
Nope.
None of the paramyxoviridae?
Cardiac scarring, people.
CMV?
Enteroviruses, too, I think.
11.
Influenza A.
Flu A. Yes. And? I'm putting RSV down as a yes. That makes 8.
8 vials of blood is pushing it.
Pushing it? But we love that. Get the antibody kits, start testing the sick kids. What do we get?
Well, the sick babies all tested positive for echovirus 11.
Great.
And CMV and parvovirus B19.
3 viruses.
But what's weirder, the healthy kid we tested, he's positive for echovirus 11 and CMV antibodies as well.
They're infants. They have their mother's blood, their mother's antibodies.
So we just learned nothing?
We have half the picture. The healthy kids survived because their mother's antibodies saved them.
If the mom had CMV in the past, she'd have the antibodies for CMV. The kid would be immune from it. So we test the sick kids' moms for echovirus, CMV, and parvovirus.
And whichever they don't have the antibodies for, that's what's killing their kids.
I'll test the mothers.
It's good news.
No, it's great.
Unfinished business?
I'm in the haystack.
Ah, because now you know you're looking for a needle.
Right.
If I tell you to let it go, it won't make any difference, will it?
Enteroviruses are spread by humans. Fecal oral, usually. Could be respiratory secretions, though.
So Cuddy got stool samples from the whole staff. Just wait till they come back.
That won't do it.
Why not?
The shedder, whoever he is, he's so virulent. He must have been symptomatic. Cuddy would have noticed him. And the babies didn't share any common personnel. That's what's weird.
Yeah, that's what's weird.
Transition team to OR2. Transition team to OR2.
Can I help you? You know why I pulled you over?
I'm so sorry, officer. I must have dozed off.
Have you been drinking?
No.
Of course she hasn't.
Somebody has.
I've been drinking. You all right?
I'm not.
How far along are you?
I've almost.
Ma'am, step out of the vehicle. Ma'am, walk to the rear of the car.
Naomi. Naomi? Naomi!
Sir, remain in the
Hey,
car.
listen,
I will
she's not
arrest
drunk,
you,
all
sir.
right? She's
Dispatch
sick.
302. Can you roll
Just
me
look
into
at
the
her. She's
unit?
not-
Get back in the car.
Naomi!
Get out!
Call an ambulance.
It's small cell lung cancer. The tumor's starting to press against your esophagus. It hasn't metastasized, but it has spread to other parts of your lungs, so we can't operate.
Wait, that doesn't make sense. She had kidney failure and brain problems.
Some cancer patients get what are called paraneoplastic syndromes. You were making antibodies to fight the tumor. They got sidetracked and attacked other cells. Your brain first, then your liver, kidneys, even the nerves that control your eyelids. That's called Lambert-Eaton syndrome. It told us the tumor was in the lungs.
How bad is it?
Small cell is the most aggressive kind of lung cancer. The 5-year survival rate is only about 10 to 15%. Which is why we have to start you on chemo and radiation right away.
Radiation? What about the baby?
You'll need a C-section before you can start the treatment. I can get you in first thing tomorrow morning.
What are the chances my baby will survive?
Pretty good. 28 weeks, so about 80%.
No, wait, that's 1 in 5 chance he'll die?
I really wouldn't advise waiting.
Naomi, you gotta start this treatment right away.
What happens if I wait?
29 weeks. The survival rate is closer to 90%.
I'm not doing the radiation.
You'll die if you...
Listen, you know the chances they're nothing, but a few more weeks will save the baby.
Listen, you're depressed right now, and you're not thinking right. So, look, could you just tell her, please?
This cancer moves quick. The median survival's 2 to 4 months. If you postpone, even for a week,
I'm sorry, honey.
She's perfect for your trial.
She's pretty far advanced.
Well, you want easy cases, you picked the wrong specialty.
Otherwise in good health?
Excellent.
When can she start?
Angiogenesis inhibitors prevent the tumors from creating blood vessels. Without blood, the tumor starves.
That sounds great.
What about the baby?
The treatment would be fatal to the baby. I've scheduled a C-section for this afternoon.
No.
It's in the trial phase right now, but so far, complete remission in more than 30% of subjects.
I told Dr. Foreman I didn't want a C-section.
When your chances of living were less than a third of what they are now.
Well, if the baby is premature, then...
Our pediatrics department has the best neonatal ICU in the state.
No, his lungs, his brain, he's not ready.
Yeah, and he could be fine.
You don't know what it's like raising a sick child.
His odds are much better than yours are. You have to let them at least try this. Talk to her.
Okay. Leave the room. How long have you been taking oxybutynine?
Since I was about 20.
Incontinence is pretty uncommon in a woman of your age. It's even more bizarre in a woman in her 20s.
I guess I haven't had the best luck when it comes to my health.
Seems that way. You said to your husband, you don't know what it's like raising a sick child. You didn't say you don't know what it would be like. This is not your first child, is it? And he doesn't know.
I was 18. I got pregnant, got married. We had the most beautiful little girl, Grace. She had infantile Alexander's disease.
I'm sorry.
For 2 years, we watched her die. My husband was my first husband was a great guy. But after that, I couldn't even look at him without thinking of her. I left him. I left my job. I left everything.
Very moving story. Explains why you're being so selfish.
I'm willing to die to protect my husband.
Because it's what you want. Your husband wants you to live.
Well, he doesn't understand.
Oh, who the hell does? Tragedies happen. You think that turning yourself into a disposable incubator for a few weeks is going to protect your baby from all the crap in this world? Go ahead, die happy. I got no problem with people killing themselves, but don't think it makes you a hero. You're scheduled for 4 p.m.
Honey? Are you okay? That's dropping down to the 80s. Stay with us, Naomi.
What's going on?
We need you to leave the room.
Respiratory distress.
Could you just tell me what's going on?
We're trying to find out.
Here.
Still kicking.
Flash pulmonary edema.
Lungs are clear. There it is.
Pulmonary embolus.
Gotta get into an OR.
What happened?
It's an embolism, a blood clot. It's fairly common with lung cancer. It's not a full saddle embolism, so blood's still trickling through. We've been able to get Naomi breathing a little, but we need to remove the clot, and we need you to approve the treatment.
Yeah, of course. Whatever you have to do, just do it.
It's not that simple. Okay, the best course for the baby would be an immediate C-section. The longer we postpone, the greater chance he'll have brain damage from lack of oxygen.
Fine, whatever, just do it.
Here's the problem. The C-section would be very, very dangerous for Naomi.
Dangerous, like...
In her current condition, there's a real chance she won't survive. I'm sorry. Look, your wife's unconscious. We need you to make a decision.
I just want her to live. No C-section.
She had trauma during the procedure. She's bleeding into her abdomen. There's nothing we can do. I'm sorry.
No.
I need you to okay the C-section.
Yeah, that's gonna kill her, right?
Probably will.
I can't do that.
She's dying either way.
I'm sorry.
Stay with me, Sean. I need your okay on this.
She makes the decisions, and I'm...
Right, and that's gonna be tough from now on, but this decision is easy. You know what you'd want.
I can't do...
You make this call, only two things change. One, yeah, you feel guilty for killing your wife. Two, your baby lives. Naomi's baby lives.
Okay.
Your boy's doing good.
How about the name Brooke? She just doesn't seem like a Brooke anymore.
Brooklyn.
She's a baby, not a city.
What do you think, bud? Got any suggestions?
Toadette. I'm hungry.
I'll get you guys something to eat. Yeah, okay. Okay. Sarah?
Yeah.
Where's the baby?
No one saw anyone go in or out, and the baby's not in the nursery.
What was her condition? 5 weeks preterm, C-section because of mom's preeclampsia.
Is that the father? Mr. Lazinski. I'm Dr. Lisa Cuddy, Dean of Medicine. How long were you out of the room?
15, 20 minutes tops.
Was there a proximity alarm? No alarms.
What's that?
The bracelet on your baby's ankle has a microchip that would set off alarms if she was carried through an exit. Call the police, shut down all the exits. We were on lockdown. Nobody moves until we find that baby.
Code 7, Code 7. All non-essential personnel and guests, please remain where you are. Security personnel should report to their staging areas and await further instructions. All patients, please remain in your rooms and use call buttons if you need medical assistance. Please remain calm and wait for hospital personnel to come to you. Do not try to leave your room until the Code 7 has been lifted. Please clear hallways.
Leave it.
Please
You need to get into the room now.
Personnel or police immediately if you see anything suspicious. We cannot allow anyone to leave the hospital at this time. All personnel should remain in their staging areas unless otherwise instructed by security.
Yeah. Gotta
Please
clear
remain
the...
in your rooms until Code 7 has been lifted. Thank you for your patience and cooperation.
And did anyone, other than your nurses, ever come by asking about your daughter?
No, just those two.
I'll check in soon.
Wait.
What are you doing?
No, I need to help them look.
No. You have to stay in bed. You pulled a stitch. Lay back down. I got it. Why don't I give you something to help you relax?
No, I don't want to relax. I want to find my baby.
The police are searching room by room.
Who would take her? What if she needs to be fed?
We're gonna find her.
Why aren't the police talking to our nurse?
They think I took the kid. Do you think I would do something?
I'm just asking questions.
The dad let the older brother hold the baby for the first time. So I put her in his lap. After a few seconds, she shrieked. I'm pretty sure he pinched her.
I need to know this stuff. Anything out of the ordinary.
It was sibling rivalry. I thought it was kind of ordinary.
Walker wouldn't do anything. He's my son, too.
I don't mean to sound cold, but he's your stepson. We can't ignore any possibility.
Walker's been getting in fights a lot at school lately. Last week, he hit another kid with a book, hard enough to draw blood. If he did something to the baby...
It's understandable that you wouldn't be happy right now. Your world is changing. You scared? And how do you feel about your sister?
I hate her.
Walker, this is important. Did you do anything to the baby? Did you move her somewhere? Hide her?
No.
Nobody be mad at you?
I said no, so stop asking me.
No news. How you holding up? You let them sedate you?
Yeah. Do you have kids?
A little girl. I adopted her last year.
I adopted Walker right after Donald and I got married. What if I can never love Walker the way I love my daughter? Does that make me a horrible person?
Let me get you some tissues. Did you request some extra towels?
No. What? Why?
There are 8 towels in Sarah's room.
Okay.
There should only be 4.
Housekeeping handles towels.
I need you to track down their logs, figure out who was up there and when.
Because they got extra towels?
Just find the logs. Now. Adrian, you okay?
Sure.
What's wrong?
Adrian, give me your arm. The hair on her left arm is standing up. Asymmetric neurological function. She's having a pilomotor seizure.
She seemed fine a minute ago.
She was. She's probably been having complex seizures all day. She'd be basically functional, but more or less acting on autopilot. She probably dropped the towels off twice. She could have taken the baby.
Anything? We've covered every room on Maldonado's logs, been everywhere she's been.
Where's the other cart? Isn't there usually another cart in here? Okay. Okay. Hi.
No formula, just mommy's healthy, natural breast milk.
Yummy.
Her whole face just got swollen like this overnight.
Mm-hmm. No fever. Glands normal. Missing her vaccination dates.
We're not vaccinating. Gribbit, gribbit, gribbit.
Think they don't work?
I think some multinational pharmaceutical company wants me to think they work. Pad their bottom line.
May I? Ribbit. 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 Yeah, all natural, no dyes is a good business. All natural children's toys. Toy companies, they don't arbitrarily mark up their frogs. They don't lie about how much they spend on research and development. And the worst that a toy company could be accused of is making a really boring frog. Ribbit, ribbit, ribbit. You know another really good business? Teeny tiny baby coffins. You can get them in frog green, fire engine red. Really. The antibodies in Yummy Mummy only protect the kid for 6 months, which is why these companies think they can gouge you. They think that you'll spend whatever they ask to keep your kid alive. Want to change things? Prove them wrong. A few hundred parents like you decide they'd rather let their kid die than cough up $40 for a vaccination. Believe me, prices will drop really fast. Ribbit, 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 ribbit.
Tell me what she has.
A cold.
Hang on. Hey, who's in charge of the backdrop? Naomi.
Yeah.
What's wrong with it? Well, the words are completely jumbled. What? You can read that?
Of course. You okay?
No. Oh, God. I could be having a, what's the mnemonic? F is for face. Is my smile crooked?
What are you doing?
A is for arms. Arms.
You should really sit down. Can someone get her some water?
S is speech. I'm slurring. I'm slurring. Huh? F-A-S-T. T is time. Hurry, somebody, call 911. Tell them the vanished truck.
Welcome to the world of maternal mirror syndrome. Mom's body is like an intricate German metro system. All the trains run on time. When she gets pregnant, it's like a new station opening in Dusseldorf. Bunch of rookies running things. Bound to be mistakes. Kids playing the tracks get electrocuted. Before you know it, trains are backed up all the way to Berlin, and you get a bunch of angry Germans with nowhere to go. We all know that ain't good for the Jews.
Well, who are the Jews in this metaphor?
A few things can happen to a fetus in distress. It can become a miscarriage, stillbirth, very sick baby, or on rare occasion, a time bomb. Kills mom while it's dying. Good news is, we fix the fetus, mom gets better. It's the diagnostic equivalent of a 2-for-1 sale.
You said sedation was risky. This sounds insane.
The injection goes into the umbilical cord.
The baby won't feel a thing.
Fetus. I'm lowering expectations. It works here and on dates. The benefits outweigh the risks, and the paralytic will wear off in an hour, okay?
Must be easier to hear you might die than your baby might die. But if there's anyone I would trust to save my baby, it would be Dr. House. There's a blockage in the urinary tract. Simple terms, your baby can't pee. His bladder is swollen and it's crushing his lungs.
Well, can you fix it?
We can insert a small tube in the baby's bladder that makes the urine come out straight through his belly for the duration of the pregnancy. The bladder decompresses and the lungs will be able to develop normally. When the baby gets better, you should get better. First, we just have to do a test to determine whether the baby's kidneys are functioning properly.
And what if they're not?
If they're already too damaged, then there's really nothing we can do.
My stomach is killing me.
It's not a stomach.
Can you open your eyes, Emma? I just need to take a look.
The swollen bladder was not the only problem. You can't leave it inside you. We have to terminate.
Well, can't you deliver him? Put him on a respiratory machine till you figure out what's wrong.
We can. It won't matter. The fetus is still at least 2 weeks away from being viable.
Oh, well, I'll suffer through this for 2 more weeks then.
You're on dialysis for your kidneys. Your kidneys can wait. They don't make dialysis for your liver. You're not gonna make it 2 more days.
I'm not gonna let you kill my baby.
It's killing you.
I'm not having an abortion.
It's not a baby, it's a tumor. I understand dying for a cause, sacrificing your life so your child might live, but that's not the choice here. Either it dies or you both die.
Or you fix him and we both live.
I can't fix it. I'm scheduling a D&C.
I won't consent. So I guess you have 2 days to figure it out.
What if our original assumption is wrong?
It isn't.
If we assume she doesn't have mirror syndrome, then terminating her pregnancy isn't going to help her liver at all.
We eliminated all other possibilities.
The fetus is hydropic and in distress. Emma's kidneys and liver are failing. The diagnosis is solid.
Wow. The ass kisser won't agree with you. You must be even wronger than I thought.
Fine. Let's assume she had mirror syndrome, but we fixed it when we fixed the baby's bladder. That means that her failing liver would be completely unrelated. If it is, we can fix it, and we don't have to terminate.
So her theory is that our patient's liver problems were just a giant coincidence.
It's not a surprising coincidence. Pregnant women can develop liver problems. If this is the case, we can actually do something here. Don't you guys think that's worth exploring?
Acute fatty liver of pregnancy would have the same symptoms.
Thank you.
Brown noser.
Viral hepatitis, HELP syndrome.
Oh, look. Sticking up for your girlfriend. Who says chivalry's dead?
We were able to control the preterm labor with tocolytics. The contractions have subsided for now.
And the liver biopsy was negative. This is definitely Mare syndrome. Her baby's doing this to her.
We're out of options.
Did the biopsy cause the preterm labor or did it happen on its own?
It doesn't make a difference.
Preterm labor can be a new symptom. New information gives us new theories. Isn't that how it works?
Not in this case. Her body's trying to do what you refuse to. Get the baby out and save itself.
Patient's transminases are 10 times normal. Her liver's on the verge of shutting down completely.
A torch test could...
We don't have time for more tests. We have to terminate or she'll die.
What do you think House would do?
House wants to terminate.
I mean, if he didn't, if he shared my position, what do you think he would do?
He wouldn't share your pain. He'd be objective.
Right. He would prioritize his problems.
He'd terminate.
He wouldn't be afraid of screwing with her lungs if there was a bigger issue.
There is no bigger issue. She needs her lungs.
Not right now. She's already on a respirator. The machine is breathing for her. I can do whatever I want to her lungs. If you're playing catch in the living room and you break your mother's vase, you may as well keep playing catch. The vase is already broken.
Yeah, except that room can't breathe without that vase.
Putting her back on corticosteroids.
His lungs are still 2 weeks away from being viable.
But big enough for a diagnosis.
These tissue buds are new. Could indicate bronchopulmonary sequestration or diaphragmatic eventration.
I was thinking bronchogenetic cysts or bronchial atresia.
Maybe lung lesions. We're gonna do open fetal surgery. Open the uterus, cut out the fetus so we can look around. I know you can't talk, so I need you to look petrified if you consent.
The umbilical cord won't be cut. During surgery, your body will basically serve as the baby's heart-lung machine. We find what's wrong and we fix it, if we can.
Don't lower expectations if you want them to do something.
She should know what she's facing. This is incredibly dangerous. It risks both your lives. The only reason why we're suggesting it is because there's nothing else we can do.
So my kidneys, liver, and lungs are all fine, just like that?
Just like that.
That's amazing.
What's amazing is how blonde your baby's hair is.
My baby?
You know, the thing in your belly that tried to kill you.
You've never called him a baby before.
Any pain?
Nothing I can't deal with.
You can only get out of bed to pee, poo, or shower, and absolutely no sex. So stop flirting with me.
Sorry. So this really worked. He'll be normal.
You call being born twice normal.
Thank you.
Don't thank me. I would have killed the kid.